I'm Josh Ratner from HealthAlliance of the Hudson Valley, and this is HealthAlliance and You. Today we're speaking with Dr. Dominique Delma, chairwoman of obstetrics and gynecology at HealthAlliance, about cervical cancer and human papillomavirus, commonly known as HPV. Cervical cancer used to be the leading cause of cancer death in women in the United States, but in the last 40 years, the number of cervical cancer cases and related deaths has decreased significantly. Now, approximately 12,000 women in the U.S. get cervical cancer each year, and the main cause of it is HPV. Thank you for joining us today, Dr. Delma.
Thank you for having me.
Can you explain what HPV is?
HPV is an acronym for human papillomavirus. It is the most commonly sexually transmitted infection worldwide. It affects most commonly in both men and women and causes many serious health care issues.
What are some signs and symptoms of HPV?
Most people don't really know that they have HPV. The most commonly way of diagnosing is HPV is mostly typically in women who come to their gynecologist and having a pap smear as well as HPV testing.
Are there potential health problems with HPV?
Yes, there are potential health problems, not only physically but as well as emotionally. When told about having a sexually transmitted infection, patients become very anxious. Some of the other things that you can see are vaginal penile warts. Women can lead to cervical cancer. Sometimes in rare cases, you can have oropharyngeal cancers, which is cancers in the throat and the mouth, as well as vaginal, vulvar, and penile and anal cancer. So there are a lot of potential serious risk dealing with HPV.
You mentioned cervical cancer. Who's most at risk for developing cervical cancer?
Most women are at risk. Women who are sexually active more commonly will be infected with HPV in their lifetime.
And are there signs and symptoms specifically for cervical cancer so folks at home can maybe tell the difference between HPV and cervical cancer? What are the signs and symptoms?
Some of the signs and symptoms that one can see is abnormal discharge, bleeding after sex, are some of those. And then as well as if you have vaginal warts, you should really come and be evaluated by your doctor.
It sounds pretty serious. Are there ways that women and men, for that matter, can prevent HPV and in women, I guess, cervical cancer?
You can start by going to your regular doctor, and they can vaccinate you with the Gardasil vaccination, which usually is given at the age of 9 and 26. You can also reduce your risk by limiting your sexual partners and using condoms, and as well as people who can use condoms during sexual intercourse.
We've heard a lot, I think, in the general media about the vaccination. How does that work?
How does that work? It's 3 series of injections that are given, and your doctor will assess you and discuss with you, and if you're at the age group, can receive the vaccine.
And this would be at any age group, or?
No, between the age of 9 and 26.
9 and 26, okay. And is it an actual vaccine? Are you then prevented from getting HPV?
You know, it's really it's targeted into the high-risk HPV that could lead to cervical cancer.
And if you think you may have cervical cancer, how is it confirmed? How do you detect cervical cancer?
One, most women do typically go for their yearly exam, and then the cells have become abnormal, and then you follow it up with your doctors. And then there's a test that you can do, which is colposcopy, which is diagnostic of cervical cancer. And then your doctor and you will get to know this, and then you get diagnosed with cervical cancer at that time.
Is that commonly referred to the test you were talking about? Is that a pap smear?
A pap smear is just a screening test that detects abnormal cells.
If you have cervical cancer or HPV, are you at risk for not being able to have children?
Not typically, no. If you have abnormal cells on a pap, your doctor will give you recommendation on what to follow up with. And cervical cancer is a continuum. It's not something that it takes time for it to become cervical cancer. So it's not going to prevent you from having children.
A long time?
It could be anywhere from 8 to 12 years.
Can you tell us, are men at risk for developing HPV?
Yes, they are at risk for developing HPV. And that typically is due to the amount of sexual partners one has.
So the more partners, the bigger the risk?
Yes, the more partners, the bigger the risk.
And how do men know if they have HPV?
Unfortunately, sometimes many people do not show signs and symptoms of HPV. But if there's a growth in your penis, I believe that you should follow up with your doctor. In majority of the times, how men will know that they have infection with HPV is if their female partners will come and say, I've had an abnormal pap and I've had a positive HPV. Maybe you might want to go and follow up with your doctor.
Sure. So other than the vaccine, what can women do to promote good body health?
Other than the vaccine, what you do is make sure that you have good health, decrease your risk of becoming immunosuppressed, especially with HIV. We would say limit your smoking, increase your utilization of condoms during sexual intercourse, and then limiting your sexual partners.
Great. Well, thank you, Dr. Delma. This has been very informative.
Thank you for having me.
We hope you, the viewers, found this edition helpful in answering your questions about cervical cancer and HPV. Make sure you're up to date with your screening exams and contact your doctor if you experience any signs or symptoms of HPV. That's all the time we have for today. To get more health information or to view this episode again, visit hahv.org. I'm Josh Ratner, and this was Health Alliance and You.